Many people get a bit scared when we start talking about cancer. And we typically do a lot more about the breast cancers, prostate cancer, and so on and so forth, cervical cancer. We tend not to talk too much about the lymphomas and other types of cancer. So, Dr. Basheer, let me start with you. Briefly, just give us a scope. What is Hodgkin's lymphoma?
Okay, thank you. So first of all, as you've said already, it's an often overlooked aspect. Hodgkin's lymphoma, other lymphomas as well, not as common as breast cancer.
Right.
But it's still a deadly disease. So it's we thank you again for letting us the
You're most
opportunity
welcome.
to speak about this. So lymphoma is a cancer of the lymph node. So I'll
Right.
go into detail about
Right.
what cancer is, what lymph node is. So in lymphoma, there's two types. There's Hodgkin lymphoma, then there's non-Hodgkin lymphoma. Today we're talking about Hodgkin
Hodgkin's,
lymphoma.
right.
But I want to preface this that the symptoms in both of them, they are quite similar.
Similar, right.
So if you see these symptoms and you go to the hospital, you can be diagnosed with either of them.
Right.
It's through further testing that we can differentiate between the two.
Great.
So Hodgkin lymphoma, a type of cancer that involves uncontrollable growth of cells in the lymph nodes. So first of all, what is a cancer? A cancer, to explain to those who don't understand, because I've talked to some people who thought maybe cancers are caused by viruses or bacteria. They don't really know what cancers are. So
Joy 99.7 FM.
cells, they grow. When they need to grow, they grow. When you've maybe damaged a part of your skin or something, the cells there, they grow and they heal. But sometimes it can happen that in that growth, there can be an abnormality. And because of that abnormality, there can be a mutation in the cell. Now this cell, the body, once it's done growing, the body tells this normal cell that, okay, stop growing, I don't need you to grow again.
Right.
But this cell that has a mutation, it doesn't listen. So it keeps growing and growing and growing and growing. So this is one basic aspect that you see in
So
almost all
uncontrolled
cancers.
cell mutation, cell growth. Right. Cancer. Right.
Yes.
Okay.
Then next up, what is a lymph node? So the immune system of the body is the system that protects you from infections. I wanted to go a little bit about into that. I can categorize them roughly into white blood cells and the lymphatic system.
Yeah.
So the white blood cells, and I like to use the analogy of police officers here, right? So where the white blood cells, they are the police officers who are there in the streets catching criminals, all that stuff. The lymphatic system is like the police station, the police academy, and these organizations. So a white blood cell or a police officer will catch a criminal or a disease-causing organism, and it will take it to a police station or the lymph
The
node.
lymph node or the lymph glands.
Yes.
Right. Okay.
So a lymph node is a collection of these police officers. They get brought the disease-causing organism and they deal with it. They kill it.
So when your lymphatic system is working properly, adequately, then it's filtering the lymph from the blood, right? Taking that to these police stations, the lymph nodes,
Yes.
right? And we're now discussing a cancer of the lymphatic system, right?
Yes.
Which relates to the lymph nodes.
Yes.
Okay.
Yes.
Right.
So I've talked about the types, the Hodgkin, non-Hodgkin.
Yeah.
Then Hodgkin too, there's some types, but I don't want to get into that
No
because
problem.
For the general public, it doesn't really help them at all. But I want to get into why it's important to know about this condition. So worldwide, in 2020, there were 83,000 new cases of Hodgkin's lymphoma, and
Okay.
of them, there were 23,000 deaths. So this is a large number. In Ghana, too, in the year 2021, there were 146 new cases, and of them, 64 of them passed away, sadly.
Right. Okay.
It is most common in people of the ages between 15 and 35 and people above 55 years of age.
Right.
And it is actually the most common cancer in people of ages 15 to 19.
the young
So
persons,
yes,
right.
so the SS students, they are most at risk. Is the most common cancer in them.
Right. Right. Thanks for joining us. We're streaming into your territory. Hodgkin's lymphoma. We just had an explanation. Abnormal cell growth, right? And affecting your white blood cells, and then it goes into the lymphocytes, and then it goes to the lymph nodes. Is there anything you want to add?
Okay, so basically, it's not just lymph nodes, so it's the lymphatic system.
Lymphatic
so
system,
the
yeah.
lymph, the spleen. It can even have a primary bone marrow lymphoma. So it's in addition to the lymph nodes, you can have the spleen, you can have the bone marrow, and So and anywhere you find lymph nodes, so you can have lymph nodes in your stomach. So it's not just the ones we see in the periphery. So that's basically what I wanted to articulate.
So not just the neck and the lymph nodes. For listeners and viewers, when you are ill or there's an infection ongoing, you get these swellings in your armpit or the axillary area, your neck, sometimes your groin area. These are all lymphatic organs, right? The police stations that Hamza was talking about, okay? Because the system picks up all the bad stuff in your blood, in your system, and cleans it up and then sends it back. So it's like your waste management, your Zoom lion in your body, right? And that's what we're talking about.